everyone, and welcome to today's session on recognizing anaphylaxis and using an EpiPen. Before we get started, I just wanted to let you know on a little bit of housekeeping. So, in case of an emergency or evacuation, out the doors and turn right, go down the steps to the bottom, right to the bottom, and there's a car park that you can all get. If you go down the steps to your left, that's going to take you in the other direction, and do not use the lifts, okay? So if you could please keep your mobile phone on silent during the session, and also if you need the toilets, so just out this door to your left, and the ladies' toilet is on the right if you need it, okay? So, we're ready to start?
Yes.
So, our learning objectives for today. So what we're going to be covering today in the session is identifying signs and symptoms of anaphylaxis, understand when an EpiPen should be used, and demonstrate the steps of administering the EpiPen. Now at the end, we're going to have a practice session of how to use the EpiPen, and then if time permits, we can do a quick quiz, but if we don't have time for that, we might just, I'll give that to you to take home, and you can do that when you get home, okay? So let's start with what is anaphylaxis. Now, before I go to what is anaphylaxis, I just want to quickly tell you what an allergy is. Has anyone had any experience with anyone with allergies in their families? Have you got allergies?
I'm allergic to penicillin and bees.
Oh, wow. Do you use an EpiPen?
I have an EpiPen.
Oh, wow, that's going to be so good. You, Jody?
I just get hay fever, sometimes
Yeah.
like itchy, rashy skin.
Oh.
Like sometimes the other day I was moving some stuff and I was really itchy and I just knew I was having
That's
a reaction to something that I touched.
Okay, so that's good.
Mm.
Two pretty good real life experience people here, so this is going to be pretty easy. So an allergy is when the body creates an immune response to an allergen that's in. The allergen can be harmless, but the body just tries to protect itself against that allergen, so it produces some antibodies, and that's how you end up with an allergy. So an allergy can range from mild to moderate or severe. And when we're looking at severe allergies, that's when we start talking about anaphylaxis. So anaphylaxis is a severe and a life-threatening allergic reaction. It can occur within minutes of exposure, or it can occur a little while after. And it requires immediate medical attention. So this is a life-threatening allergic reaction, and it needs immediate reaction. Now, some of the common triggers, you were saying, Michelle, that you have bee stings, so that's the insect ones. And Jody, what were you saying?
I was saying like something I've touched, or I was moving furniture in a business and I don't know what it was, but I felt like I smelt a bit funny, and my, I was like itchy, which made me look that I had a bit of a rash.
Yeah, and also we can have allergies to medication. So what do you think some of the medications you can have allergies to?
Or like Tingle said, penicillin,
antibiotics.
Yeah.
Some people are really sensitive to latex gloves.
Yeah.
Oh yes.
And they can end up actually having anaphylaxis from that. And food allergies is really, really common. Nut allergies, shellfish, eggs. In schools now we're seeing more kids with strawberries, kiwis, so those kinds of things, okay? So those are some of the triggers. Now, what about the signs and symptoms? So when we're looking at severe allergic reaction, that is called anaphylaxis, as we've said.
Yeah.
And the signs and symptoms of this anaphylaxis is difficult breathing. So that immediately when you have a severe reaction, your face, anything involving the face, so it starts with the breathing, so your throat gets really tight, and then your breathing gets really labeled, and you can actually go, like, sometimes get a hoarse, right? So you can go, that kind of breathing. Swelling of the lips, you can get swelling of the eyes as well. We've seen that with children. You can start off with hives and a rash, and you can get dizzy and collapse, right? Or in case of bee stings, you can get severe abdominal pain. Do you get abdominal pain, Michelle?
I do.
Yeah. So that is one of the signs of an insect bite when you get abdominal pain. Okay. So the dizziness comes about when because your blood pressure is dropping, your pulse is increasing, so that's why you feel dizzy and you may collapse. Okay. So what do we do in this case? Firstly, we stay calm, because that person that's experiencing that allergic reaction, that anaphylaxis, is already stressed,
Yeah.
and they're breathing. So we gotta stay calm so that we can have a clear head and be able to help them, right? We gotta use the EpiPen immediately, because this is the only medication that is gonna help with this anaphylaxis, right? Now, in that EpiPen is contained adrenaline. And adrenaline is a naturally occurring hormone in our body, so we can't do too much harm to the person if we give it, even if we're not sure.
Okay.
And we give the pen, we can't harm them too much. So we got to follow the person's anaphylaxis care plan, which we spoke about in the first session. Okay, so any questions so
Yes, the
far?
worst thing you can say to somebody that's having anaphylaxis is, "Are you alright?"
Well, calm down.
Because if you say, "Are you alright?" they go.
Yeah.
So
And that's probably a sign of no, I'm not alright.
Yeah. So stay calm as much as you can, but remember at the back of your mind, if you're seeing all these symptoms, you are going to be looking for a pen, okay? Because that is the only form of treatment for this person. So we're going to go on to the actual how we actually use the pen. I'm going to show you a video first, and then I'm going to actually physically show you how to do it, and then I'm going to let you practice how to do it, okay? So let's have a look at this video. So are we clear on anaphylaxis and how it happens?
Yes. Yeah.
Right.
This video shows how to use an
Is the volume
EpiPen
okay?
to help someone who is having a severe allergic reaction known as anaphylaxis. Follow instructions on the Askia action plan stored with their EpiPen. When someone is having anaphylaxis, help them lie down. If breathing is difficult, help them sit up, but they should not stand or walk. Make a fist around the middle of the EpiPen, keeping your fingers and thumb away from either end. When you hold the EpiPen, it's blue to the sky and orange to the thigh. Pull off the blue safety release. Place the orange end firmly against the middle of the outer thigh. The EpiPen works through a single layer of clothing, but not through pockets or seams. Push the EpiPen down to the thigh until you hear a click. Hold firmly in place while counting to 3. When you remove the EpiPen, the orange end will extend over the needle. Put the EpiPen to one side, call 000 immediately and ask for an ambulance. Do not allow the person to stand or walk at any time. The person must stay in hospital for at least 4 hours. For more information on allergy and anaphylaxis, visit our website or call our helpline on 1300 728 000, or visit the website for the Australasian Society of Clinical Immunology.
Okay, so that was the video, and at the end it just told you where you can access that video from. It's a really easy video to understand, isn't it?
Yeah.
So there's a few things that they've mentioned in that video that we're going to talk about as well. So firstly, I brought along some trainers for you. So we're going to have one. Michelle, you're going to be really good at that. So this is a trainer. It's got no medication in, so
Yeah.
you can't give yourself
A dose.
any dose of this. Okay. So firstly, when we're looking at an EpiPen, so it's going to come in a box.
Yeah.
EpiPens come in two sizes, one for an adult size and one for a child size, okay? So when we're looking at an EpiPen, take it out of the box, you will see in the real life EpiPen, you will have a little window in the pen. And that's where you can see the adrenaline that's in there, the medication that's in there. So we want to make sure that the EpiPen is not expired. So making sure your EpiPens are all within date. And we want to look at that window very briefly and make sure there's no stuff floating in that window. If there's any black in it or anything like that, we're not going to use that pen. If the pen is, and I get asked this question a lot about the expiry, if the pen is reasonably within an expiry date, you can give the pen.
Right.
Because rather give it than not give it, okay? So if you have a look at this pen, it's cleverly designed. You've got blue on the top, which is the cap, and you've got orange at the bottom. So the rule of thumb is blue to the sky and orange to the thigh. Now, when we are looking at holding a pen, we've got to make sure that we are gripping it firmly so that the pen, when we actually administer the pen, there's no sort of back force with that, okay? So
Yep.
when you're holding it, the best way to hold it is in a fist, okay? And try to keep your thumbs in if you can, and hold it in a fist, okay? Now, what we're gonna do, we're gonna first start off by taking the cap off. So take the cap off. Now, why do you think we take the cap off?
It's a safety switch.
It is, because if you don't, when you take the cap off, it releases the mechanism to actually give the pen. If that cap stays on, you can do as much as you like and nothing's gonna happen, okay? So we wanna take the blue cap off first, and then what we wanna do, we wanna make sure we hold it in first. We wanna look for the outer thigh. We wanna look for, we're giving it in the thigh because the thigh is the biggest muscle that we can find. It's an easy place to access if someone is having anaphylaxis. Now, we can go through clothing as long as it's not a tough seam or a thick seam or anything like that. But otherwise, what you're wearing, what Michelle's wearing, what I'm wearing is perfectly fine.
Okay.
So we want to say to the child, we are sorting you out, we're going to give you your EpiPen, you're going to feel so much better. And then what we're going to do is we're going to go against the outer thigh, we're going to press on it. We're going to
There's no
wait
needle
till we
in
hear the, there's no needle, it's
Excellent.
Right, did you hear the click?
Yep.
And once we hear the click, we're going to count. 1, 2, 3. So we're holding it down for 3 seconds. So remember, 3 seconds only, and then we're going to release. When we release, we'll see the sheet comes out. This is a really clever design because it actually covers the needle. So you
Yeah.
don't have any issues with the needle stick injury.
That's great.
The important thing to do is after you've given an EpiPen is to hang on to the EpiPen. And we have to call 000. So that if there's anything that I give you a takeaway on home today is call 000 if you're giving a pen. Why do you think we need to call 000?
Well, they're medical professionals, so they can then observe and see how the person's travelling afterwards.
Excellent, Jody, because we have to monitor them, as the video said, for 4 hours after they've had the injection.
Yeah.
The other reason is that if symptoms do not improve and they're getting progressively worse, another EpiPen can be administered in 5 minutes after they've had the first one. So 5 minutes later, another one can get administered. So it's really important that we call the medical people to and then hand that pen over. The other important thing to do is to note the time, if you can, what time it was given. Usually it's a good idea to write the time on the person's arm or somewhere on their body, because then, you know, if you're not there, someone can see, so that the medical staff can see what time it was given and then work out when they can have. Now I want to pose a little bit of a tricky question to you. What happens if you do the whole procedure, you give the pen and you pull it out there, did they get that dose or not? What would you do?
You can check the window to make sure there's no adrenaline.
Yeah. But what would you do? What do you think you would do?
Wait till the ambulance arrives.
Perfect, because we do not give another pen because we have no idea how much medication has gone in or not gone in. So we will not give a new pen until 5 minutes later or until medical staff arrive.
Usually people only have one pen on them anyway.
I was just going to say,
and this is why you would call
000.
000. Yeah.
And obviously it's only 1 dose per pen.
Yes.
Is that right? Yeah.
Yes. Yes.
Didn't know that, so that's interesting.
So it's 1 dose per pen.
I was going to say they're expensive.
Yeah. Yeah, they're quite expensive.
How
But
long
if
do
you
they
give
last
them a year,
Right.
as far as
Might go a year, might go 18 months before
I was going to say you want to have an
You don't want to have an
anaphylaxis. You don't want to have it, but you'd want to use it, wouldn't you?
Yes, yes. So a few important things that we went through with that, but we'll go through that again in after we start giving. So what I need you to do is to practice the activity, how to give the pen. Practice on yourselves, and then I'm going to quickly watch how you're doing it, and then we'll move on. Okay? So any questions while we start practicing? So to reset the trainer, just push the orange in and put the cap on. How many are we counting?
3.
Well done. how does it make you feel that you can use the EpiPen now?
Good, can save someone's life. I've always wanted to use one. I think I'm a doctor sometimes. So.
Look, you are well within your rights if you give an EpiPen, but do it with the duty of care.
Yeah.
I mean, you cannot take an EpiPen and poke it in someone's eye and
Oh,
think
God,
you're
no.
gonna get away. Give it in the right spot. If sometimes if you're in an emergency situation and you're panicking yourself, you can always call to someone else to help you or just to settle you down or anything like that.
I
Okay?
find I'm really
To
cool,
help.
like a cucumber in emergency situations. It's weird. I'm quite excitable all the time. But when there's emergency, I'm like, I take control.
Yeah.
Like, get out of the way. Let them breathe.
Yeah.
I
So
saved the lady's life
I've
once.
got some resources for you. They are the AskCare website as well. They're really good. So if you want to go into a little more detail on how and why and all those kinds of things, you can have a look at these websites. They're really good. The AskCare one is a really reliable one. Okay, so I also brought you this to take away with. You can use that to just familiarize yourself with that and see how you go. So I wanted to check with you. So if you had an emergency and somebody was carrying a pen, and the person you went up to and said, and they were like, and what would you say to them?
Well, obviously I'd be identifying that they're having some sort of
Perfect.
reaction to something.
Yes.
And then I'd ask them, do you normally have reactions?
Yes.
And then I'd ask, do you have an EpiPen? And where would I find that?
Yep.
Yep. And if it was like on the beach and there's lifeguards or something, then if they didn't have one, I'd certainly turn straight away to someone like that to see if they've got a pen.
And what if they said they didn't have a pen?
Well, I'd be getting someone to call 000 probably before all of that anyway.
Perfect.
I know you said after, but like if somebody's
And
really
you
not
can do
well,
it, you can do it simultaneously.
Yeah.
You can even do it before, as you're reaching for the
Yeah.
pen or as you recognize, you can do it. But when I say after, I mean definitely after.
like if you're the
you
only
use
one there,
pen,
yes.
you must call an ambulance and get that
Yeah.
person to the emergency hospital and get some treatment. Tingles, you want to tell us about your experience with
When I
Go on, tell us.
Did you have to give a pen at any time?
on myself. But yes, I missed the thigh and hit the knee, and it was bloody painful. No, but a bee landed on me, and I knew I was allergic to bees, so I was watching it, just waiting for it to fly away. Anyway, I had enough, so I flicked my finger to get it off, and it stung me.
Yeah.
Yes, and I was like, oh, that's cool. And then it took a little bit of time, and then I thought, I don't feel too good. And then I got slight stomach cramps, and then the lifeguard. I was at the pool. I was in the water on the side with all the bees were coming down to drink. So yeah, he says, did you just get bitten by a bee? I'm like, think so. Yep. And he goes, I didn't think so. Obviously, yes.
Yeah.
I think so. And he said, you're allergic? I'm like, yep. He said, where's your EpiPen? I said, right there. So I grabbed my bag and pulled it out. And yeah, I went down through the water and hit my knee. So it was painful.
Yeah.
So did you get your symptoms improve after that?
Yes, they did. And I didn't. I said, don't call the ambulance. I'm fine.
Yeah.
So, but that's the only time I've ever done
Yeah.
it. So make sure you get the
fatty
thigh.
thigh. Yeah. And is that why? Because it's
and
like fatty
yes,
muscle.
and there's more surface area.
Oh, right.
Because if a person is if anything is happening around their face, they don't want you coming near them.
No.
So we want to go to a surface area that is wider and
Yeah.
that is accessible.
Right.
So even if there's two people and if you're holding the person and comforting and keeping the person calm, the other person can be down there and work. So we also learned from the video that when a person is having anaphylaxis, we don't make them stand. We don't let them stand. We don't let them walk. We treat them wherever the anaphylaxis, the severe reaction is happening. And the reason for that is that if you stand someone up, what happens to your body?
You can get a rush of blood.
All your blood
Yeah.
goes down to your feet because of gravity, right? And in anaphylaxis, we know that the blood pressure is dropping and we know that the pulse is increasing, right? So what we want to do is make sure that that blood returns back to the heart.
Yeah.
And the only way we can do that is to get them to sit flat and or lay them down, or even if they you know, when a person's having a difficulty breathing, they are gonna not want to lay flat.
No.
So even if you get them in a half sitting position, but their legs must be flat, and
Yeah.
you can actually, if you have time, raise their legs as well, so
Okay.
that you can
So
help
the
them.
blood
So,
flows back.
yeah, and we don't want, because they're dizzy already, we don't want them walking and collapsing anyway. So
Mm.
treat them where they're at. If obviously they're in danger in that spot, then you will move them, but you will not make them walk to wherever that you have to move them. Okay. So we all clear on all of that?
Yes.
Okay. Right.
Sounds good.
Now, I wanted to also, now that we've got some time, I brought you a little quiz.
Okay.
Right, take your time, go over the quiz, and then we will, go over that in a minute. So, I'll get some, do you have some
I
pens?
do.
Yeah. Oops.
They're a bit highlighted.
Oh, that's good, thank you.
You find them easy or?
Oh, this, I don't know about this one. Yeah, my first one I did all of them, but then I questioned the sneezing maybe wasn't enough of an allergy to,
Okay, we'll talk about it in a minute.
but probably for the pen I'd just do
Yeah.
difficulty breathing.
Perfect. How are you going?
Yep, I'm done.
Done?
I think. Yep.
You, Jody?
Yes, I'm done, yes.
Okay. So let's talk about it, okay? So the first question was, which of the following is a sign of anaphylaxis? Now, was a little bit of a tricky one,
Yeah.
Jody, because we did say that with anaphylaxis you can also get mild
Yes.
itching and you can get a small rash, right?
Yes.
But which was the one that we are looking most
The
for?
breathing.
The breathing.
Yeah.
Perfect. So if we say which of the following is a sign, even though all of them are sign, we are looking mostly for the difficulty in breathing.
Yeah.
Okay. So that was a tricky one, and you guys did really well with that. Okay. So what is the first thing you would do if somebody has anaphylaxis?
Administer the EpiPen.
Excellent. Did you get that, Tingles?
I
as
did.
well?
Yep.
Perfect. So, I mean, I put some silly ones given.
That's a couple.
That's good though.
Get
That's
food.
good, yeah.
Uh,
Get food, yeah.
Remember we said we will not tell them to walk around
Right,
for
that's
death.
right,
Okay. So where should we inject an EpiPen?
The outer thigh.
Out to thigh. Perfect. Because we said we're not going to go any other silly
No.
places, right? Okay. So after giving the EpiPen, what should we do next?
Call 000.
Excellent. I also said leave the person alone. Should we
Yeah,
ever
we
leave
should
the
never
person alone?
No.
We
No.
should never leave a person that we've given an EpiPen alone.
Yeah.
Okay? Wait until help comes or until they have to go to the hospital. And we don't send them home, that's for sure. How long should an EpiPen be held in place after the injection?
3 seconds.
3. Perfect. So we get all right. 5 out of 5.
Yeah.
Perfect. So, okay.
Extra
So
options.
that was really good. So we're almost coming to the end of the session. I wanted to quickly see how you go with questions.
Yes.
I know we've been asking questions along the way, but is there anything from the whole session that you want to clarify or?
No, I'm just curious, in your experience, how many times you've had, as a nurse, have had to administer an EpiPen?
Thankfully, Michelle, I've never had to administer
Okay.
it, but I spoke about it a lot of times.
Okay. That's good.
I was
Yeah.
with the person, I was at a school where the principal was giving it and he gave it and that child did end up with a really big bruise. But rather give it than not give it.
Yeah.
I'll quickly touch on this because there's some confusion around asthma and anaphylaxis, because asthma can really mimic
Yeah.
the same sort of symptoms like breathing, difficulty with the chest. If we know that the person has an allergy to something and they're having this difficulty breathing, and even though they're asthmatic, we will first treat them with the EpiPen, and then we will, if they have an allergy,
Right, yeah.
okay, we will first treat them with the EpiPen. Because we rather, if we're in doubt, rather give the pen than not give the pen.
Right.
Because like we said, adrenaline is the only medication that can actually help in a case of anaphylaxis. You can jump up and down, you can do whatever else, you can give antihistamines, nothing's gonna help because we need that adrenaline to stop that anaphylaxis from happening.
So if you were to give it, say, wrongly, because let's just say the child's asthmatic and it's slightly misdiagnosed because we're not professionals, and we give the pen, will it help the asthma symptom? Will it make them breathe a little bit easier?
Depends.
Yeah.
It could, or it
Depends on
could
what's
not.
driven the
Yeah.
asthma attack.
Yeah.
Yep.
So
Okay.
it could, but remember we are treating the allergens that's in the body that's producing
Yes.
this
Okay.
anaphylaxis.
Yes.
So that's gonna help with that, but if you've done that, there's no harm in that.
Yeah.
If they have a pen and they have their Ventolin puffers or whatever,
Yeah.
and you've given the pen first, there's no harm in that.
Okay.
The most that can happen to you after an EpiPen given in adrenaline is that your pulse will go really high.
Right.
You'll get quite a rapid pulse rate, and you might feel weak and dizzy because your pulse rate
Yep.
is so high. But other than that, you should recover pretty quick from it.
Okay.
Because adrenaline is already in your body. It's a naturally
Yes.
occurring
Yeah.
hormone in your body. So you wouldn't do too much, upset the person too much.
Okay.
But you must ensure that they get medical help.
C2, yeah, obviously.
Yeah,
Yeah.
if you're
Yeah.
given the pen.
Yeah. And you would know within moments that that's not working?
So
Like within a minute,
yes,
say?
sometimes the response is pretty quick.
Yep.
So you'll know, like you'll start seeing them settling down. You
Yep.
start hearing the breathing is improving.
Yep.
You'll start actually seeing, and they can actually tell you themselves
Yeah.
that the symptoms are improving. If in a case where the symptoms are not improving, you've already called the
Yep.
ambulance. All you have to do is just monitor the patient, stay with that person, just keep looking at them, watching them, and just giving them encouragement, keeping them calm. I'm here with you. The ambulance is on its way. You'll
Yep.
be okay, and just wait on
Okay.
on the ambulance to come because you don't have any other pen or anything to use.
Yeah.
If they collapse and stop breathing, then we're gonna have to start CPR. But
Yeah.
that is another session.
Yeah.
CPR is another session. We can do it another time if you're interested. But for that, we will just stay with the person and monitor them and make sure that their breathing is
Yep.
improving and,
Okay.
and that their symptoms are starting to. How soon after you give yourself the EpiPen does it work?
You could feel the relief almost instantaneously, and then maybe it took me about 5 minutes before I felt confident to move
Yep.
from out of the water.
Right.
Okay, wow, thank you. Okay, so thank you so much to both of you for your participation today, and I was especially pleased because you've had some
Yeah.
so it made it interesting. Now, I do have a feedback form for you to fill out, so please fill it out when you go home or whenever you have time, and email it back to me on the email address that I've sent you.
Yeah.
And be honest, and so we can see how we need to tailor this to better suit people, okay? So if there's no other questions, thank you, and we'll see you at the next session.
Thank you. You learned a lot.